and helping us make sense of the differences between COVID and the flu. For that, we want to bring in NBC medical contributor Dr. Natalie Azar. Dr. Nat, good to see you. Thanks for being here.
Good to see you.
So as Peter said, they've got 18 positive cases they know right now within the White House, but more staffers exposed, testing negative. But is it important for them to quarantine even if they've got a negative test?
Absolutely. This is part of the containment phase. It's not just one thing. It is a pillar. It's testing, it's isolating, it's quarantining, and it's tracing. There's this issue here that they're conflating mask wearing as a prevention strategy, testing as a prevention strategy. No, you need to do all of these things. In spite of a negative test, if you're exposed, you need to quarantine for a full 14 days.
Dr. Natalie, President Trump on Tuesday revealed that he does, in fact, plan to attend that presidential debate in Miami on October 15th. That's next week. Is that medically advisable?
The problem with giving you, an expert answer on this, Craig, is that there just hasn't been good enough clarity on the severity of the president's symptoms or the timeline of when his symptoms began. Per CDC, if you have mild illness, you need to be isolated for at least 10 days after symptom onset. If, on the other hand, you have severe disease, that number goes up to 20. Are we splitting the difference? Are we saying that he had moderate illness? Perhaps, but is that really the appropriate thing to do in this instance? Wouldn't you want to err on the side of caution? We know, or we've heard, that he's going to be getting swabbed and getting PCR tests. Will there be a viral load cutoff that will indicate to his medical team that he is no longer infectious? This is the kind of information that I want to know, and the public has a right to know as well.
Dr. Natalie, can I ask you about the tweet from President Trump that was removed, actually, by Facebook and Twitter, flagged for misinformation, in which the president compares COVID-19 to the flu? It's an important question. Listen, we're in cold and flu season. Can you tell us what makes COVID-19 and the flu different?
Absolutely. So similarities, definitely. They're both respiratory viruses. They can cause viral pneumonia. They're predominantly spread by respiratory droplets. Older individuals with underlying risk factors are at greater risk. Symptom-wise, lots of overlap: fever, cough, shortness of breath, GI symptoms. I would say the biggest difference is, of course, that loss of taste and smell, as well as severe headache that is so prominent in COVID-19. How do they differ? To double down on what Peter said, there have been more deaths in less than a year from COVID-19 than in all 5 flu seasons in the past 5 years. That is remarkable. COVID-19 is also more contagious. There is, as we know, a vaccine for flu. And probably, I think, one of the most striking differences right now is that, for the most part, with some exceptions, most people recover from the flu after a few weeks without any long-term sequelae. The same cannot be said for COVID-19. In addition to chronic lung or heart issues, we've all heard about the long haulers, the long COVID, this more dramatic and devastating and incapacitating, long, drawn-out systemic illness that patients are suffering.
Dr. Natalie, I know this is a big question, but do you have any advice for people looking to kind of boost their own immune systems with vitamins or other supplements?
So, Dylan, we're going to do a little bit of a deeper dive on this. What I would say is that, healthy diet, for the most part, most of us recommend, rather than taking supplements unless you're truly deficient, to eat a well-balanced diet, and that is the best way to maintain or boost your own immune system. There's a lot of discussion about vitamin C, about zinc, about vitamin D as specific supplements that may or may not have any efficacy in COVID-19. What I will say is that the evidence base right now does not prove any cause and effect in terms of deficiencies and worsening COVID outcomes. There are observational studies that suggest perhaps a beneficial effect, particularly for vitamin D. This is something that I would advise patients or people, if they're interested, to please speak to your doctor about your diet and about checking for any levels of deficiency for any of these things for best guidance.
Good information as always. Dr. Natalie Azar, thank you for your time this morning.
Occasionally, folks wonder whether our medical experts are actually real medical experts. Yeah. Dr. Natalie talking to us from her office.
Exactly.
Clearly. Dr. Gupta always joining us from his office with his scrubs.
Seems like they live there.
They're real doctors, not TV
at this
doctors.
point.
Right. It's so interesting, Dylan, you brought up that last question. I remember right when, COVID was a thing. It was new.
It's still a thing.
I mean, it's still a thing, but right when it hit, and you rushed to the grocery store, the pharmacy to get whatever you needed. I ran to the pharmacy. I thought, let me get some vitamin C drops, some things.
I was taking tons of
Everything got wiped
Everything
out.
was gone. I remember the shelves. I mean,
Zinc
vitamin
wiped
C,
out.
zinc for the kids. It literally, when you asked that question, took me back to empty shelves.
And I was taking all that, and I still got it. So
Yeah, oh, that's true.
who knows what it does?
That's a good question. All
That's
right,
a downer.
Sorry.
she's fine now. Look at her.
Yes, we're happy.